Welcome to North of 60. I'm Heidi Schweighofer. Today we're going to talk about vital numbers, those medical tests that we all have as we grow older, and we may not know necessarily what they mean. So my guest today is going to explain them. His name is Dr. Hugh Oneill. He's with the Unity Healthcare Network. I hope that's correct. Unity Health Network. I'm sorry, I'm new to the name. Dr. Oneill went to Ohio State University for his medical degree. He's also board certified in family practice and works as a family practitioner right here in Streetsboro, so he's very close to us in Hudson. All right.
Thank you for having me.
Thank you so much. All right, Dr. Oneill, let's start with what's a lab test? So we all sort of have a baseline definition.
Okay. I think that a lab test, most oftentimes when we think about that in a medical practice and in an outpatient setting, refers to a blood testing.
Yes.
Certainly the lab test includes other things, and so if we really expand that definition, we do get into really testing on any type of body fluid. If your knee was swollen and we pulled fluid out of that and looked at that fluid, that is laboratory testing. But most of the time in the office, we're referring to blood testing that can give us vast amounts of information about different conditions and what we want to know about somebody.
And I think that's what our audience would probably be most familiar with. Mm-hmm. So how often should we have lab tests, and do we need to have them?
Every person is a little bit different in terms of what they need and how often they need that. At minimum, for our older adults, the answer is once a year.
Okay.
Oftentimes, most people are getting blood work more often than that, depending on what we're watching and concerns that we have as we get older. I will admit most of my older adults get blood work 2 or 3 times a year. Technology has made that a little bit easier. A lot of times your blood testing can be just a finger poke in the office nowadays. It's not necessarily a lab draw where they have to stick a needle in your arm. And so we can get so much information in real time. The term for that is point of care testing. So testing that we do right there in the office and get the result 5 to 10 minutes later. And so sometimes blood work doesn't mean a needle like it used to. Sometimes it's a simple finger poke. But yes, most people get blood work several times a year.
Okay, yep, I would have to say that for myself, I do too. Mm-hmm. Twice a year I go in. I would love to believe that I could have a finger poke, but it's not that easy. What is the definition of reference range?
So the reference range oftentimes gives us an idea of what's normal. If we go back in time to how lab tests were originally designed, they didn't have any idea what a normal number was for these things. This all had to be investigated and learned when we realized we could get so much information from doing blood testing. So the reference range generally includes about 95% of people in the normal range. So if we take 1,000 random adults and we check their kidney function or a blood count number as an example, that range tells us where 95% of those healthy people are going to be. And that's important because that also means that sometimes there's perfectly healthy people who are just outside of that range. And the computer system will flag the laboratory result as abnormal or high priority. And really, it's a very subtle abnormality. The other thing that's very common in our laboratory testing this year is that the computer systems oftentimes do calculations within the laboratory work. So my test may measure the direct amount of certain salts in your bloodstream, but that same test then use a calculation to determine other variances in that blood work. And so the ratio of those proteins, the ratio of those salts, how the acids and the bases balance each other out. A lot of times it's a computer program calculating those things. It's not directly measured in the laboratory test.
Does gender or race or age cause a reference range to be different?
Yes to all of those. And oftentimes in the reference material that comes on a blood test, it will include some of those differences. The most classic example of that would be kidney function.
Yes.
Kidney function that we measure in a blood test is different for African Americans than it is for Caucasians. And the test then gives us that information based on that person's age, their weight, and their race, tells us how that kidney function varies. And there are a lot of examples like that.
So I'm not going to try to make you tell us the history of reference points, but it's interesting. So it's 95% of people.
Healthy people.
Of healthy people.
Yeah.
Okay. So race is taken into consideration, but age is not. I might be very different from you, but you're still going to look for me to be within that range because of my age compared to yours.
I think that gets into the calculation part of that. And again, I'll use the kidney function example because it works so good. When we measure somebody's kidney function, the exact same number in my laboratory test could be there for you and I. But that doesn't necessarily mean that our kidneys are filtering our blood in the exact same way. As we get older, nothing works as good as it used to, including in this particular case, the kidneys. So the number looks exactly the same, but that has to do with the way the kidneys are filtering the blood, how much protein and muscle mass we have as we age, and then the computer can calculate that difference in kidney function.
Okay.
So our numbers may look identical, but our actual kidney function is not identical.
Okay. I hear I heard about this a lot with COVID. False positives, false negative testing. Is that common? I'm not talking COVID here, but is that common to have a result that may be a false positive or a false negative? And how would you know?
It is very common that we get an abnormal laboratory test and it does not point to a disease or a serious disease, if we want to think about it that way. COVID is a really good example of that, where the laboratory test is picking up on a protein that is associated with COVID. And sometimes we get proteins from other viruses. Sometimes we tried to get that protein and we just didn't pick up on it in the sample we obtained. For a laboratory test, for example, we may see that somebody's sugar is a little bit high because the range has indicated what is considered normal. But a little bit high doesn't necessarily imply that they have diabetes or that there's a serious disease here. It just means that the number is higher than we would have expected it to be. An out-of-range number does not necessarily imply disease. And you could consider that a false positive if you wanted to say, well, did this particular number tell me I had a disease? And oftentimes the numbers and the laboratory tests don't work that way.
Okay. So I told you before we went on air that I always hear about water drinking. Every single time I talk to another older person, they'll say, I'm told I have to drink more water after I visited my doctor. So tell me, what factors may influence, I guess, test results? Water drinking, dehydration, other sicknesses. What if someone's supposed to fast and they just have to have a cup of coffee that morning, or a coffee with a tiny splash of cream? How are those things influencing the results?
So I'll start with the last question and work to the first. So when we talk about fasting blood work, there are certain components of our laboratory testing that are affected in real time by taking in food and calories. Sugar is an example that I used before. Cholesterol, specifically triglycerides, which are a component of cholesterol. those are affected in real time by eating. Even something as simple as a cup of coffee with some creamer in it will raise my blood sugar. Oftentimes in the office, when we're talking about fasting blood work, black coffee and water are excluded. There's no calories there. It's just fluid, and in coffee's case, caffeine. Most of us can't get out of the house without at least a first cup of coffee. I forgot the first part of the question that I was going to go to.
The dehydration,
Oh,
other
and water
illnesses,
intake.
water intake.
So we have to be a little careful generalizing for everybody. Some people
I
need
know.
more water, but there are health conditions, heart conditions, and kidney conditions where people have to limit how much water they drink in a day. But we live in a society now where you could go weeks and months and never drink plain water. Everything has something added. There's sugars and there's vitamins. There's coloring, there's caffeine, and not a lot of people drink plain water.
I've had people actually say it makes them feel sick to their stomach to drink water in the morning. And not just water, coffee, but water. I guess that's true. There are a lot of non-water drinkers.
There are a lot of people who have found that they enjoy other things more than just water. But if I'm drinking something that a lot of us would consider healthy, like Gatorade, which is just salt, I love your facial expression, which is just salt and sugar and water, usually with a little bit of coloring added to it, that has an impact on the body. We can see that sometimes in blood testing when people are drinking lots of salty fluids. And a lot of times what we're trying to tell people when we're trying to get people to drink more plain water is we realize that there is a flushing effect that water has on us. Our liver uses that water to push things through it, toxins that our body needs to get rid of. Water helps move food through our bodies. A lot of us, as we get older, our bodies don't excrete things the same way that they used to, and water helps everything move through the way we need it to move through. Certainly our kidneys are dependent on water, and if our kidneys are always in a place where they're having to conserve the amount of water, it makes them harder to push things through and excrete the things that our body doesn't need anymore.
So, Dr. Oneill, if someone is going to go in and as part of their lab test, they're going to have kidney function test, and they are generally an older person who's relatively dehydrated, they drink coffee and tea, but they don't drink a lot of water, can that influence the results specifically of, like, for example, the kidney function test?
So the answer is yes, but I'm going to push that to a little bit of an extreme. If someone is mildly dehydrated on a regular basis, you're not necessarily going to see a big difference in a laboratory test.
Oh, okay.
Certainly in situations where people have more moderate or severe dehydration, then you'll see that in the blood testing. But what you're really seeing in a laboratory test at that point is the organ suffering as a result of that lack of fluid. So for example, a lot of people have very minor kidney disease, and their hydration on any given day doesn't make a big difference in terms of that laboratory test. However, if they had an illness and ate very little and drank very little over a 24-hour period, we would see that lab test change drastically. And we even use terms like acute kidney injury when people are so dehydrated that the kidneys have actually started to shut down because they can't filter the blood and clean things out the way they're supposed to. But subtle differences in hydration, usually the blood test does not vary enough that we would be picking up on that or changing how we're approaching somebody.
Interesting. That's interesting. I've wondered about that. I want to ask you if I can now go through some specific tests and just sort of what they mean and what we would need to worry about. Well, I worry about everything, but what we would need to be thinking about with our physician if they were lower or higher than the
Okay.
range. Glucose, let's start with that.
So a normal glucose is considered anything less than 100. So that is considered a good fasting glucose reading. You get into this middle ground with glucose. So let's say between 100 and 125. That fasting sugar is a little bit high, but does not by itself indicate a disease process. And then a fasting sugar of 126 or higher is considered diagnostic for diabetes, and would prompt other testing to investigate that further. That fasting glucose reading changes. What we would consider a normal glucose changes drastically when someone isn't fasting, because if you're not fasting, then a sugar of 130, 140 is really considered a fairly normal number for someone in that situation. So again, that fasting window has a big impact on a glucose blood test.
I hear the term pre-diabetic. So, and I hear it from people who assume that when they see that their glucose is 105, I must be pre-diabetic. Are they pre-diabetic?
So there's more testing that kind of better defines that answer. As physicians, we use a test called a hemoglobin A1C,
Yes.
and I could go into the specifics of what that test is measuring. But that test gives me an idea of an average blood sugar over a 3 to 4 month period. And for a question like that, that would give me a much more accurate answer in terms of whether somebody is in that pre-diabetes range, whether really everything was fine and that elevated glucose of 105 was a false indicator of a problem.
Okay.
Or of course, even sometimes where we get someone who has a sugar and it's 110 or 115 fasting, and we check that A1C and it's high and it's indicative of diabetes. So, but the glucose number just by itself doesn't answer a disease question. So
All right.
if you got a blood test and it said your fasting sugar was 107, by itself, it doesn't really answer any questions that you have.
Okay, all right. My mother was a diabetic, and I remember going for A1C blood test with her. It seemed like all the time.
Yeah, and that is a good example of a laboratory test that a lot of offices have now in a point of care testing. So when my diabetics come into the office, oftentimes we can poke their finger and 3 or 4 minutes later know what their A1C
Good.
is, as opposed to them having to show up the day before for a lab
Yes,
draw
that's what
for
we
me
used
to
to
have,
have to
or
do.
doing a lab draw, getting the information
Yep.
2 days later, and then having to call and make decisions with
That's
people.
exactly what we
Yeah.
went through back in the day. All right, CBCs. I know they are, go ahead.
So CBC gives us a lot of information, and so it is difficult to boil that test down into a simple statement. But essentially, this is counting and measuring the size and sometimes shape of all the different cells that are circulating in our bloodstream. White blood cells, for example, are the cells that our body uses to fight infection. There is a lot of different types of those white blood cells, and we can measure the different types and shapes as well when we're doing somebody's blood count testing. Obviously, a higher number for that white blood cell count could infer things like infections, sometimes serious, sometimes not. There are medicines that can cause that number to be high as well. And there are more serious conditions like certain types of cancers that can cause that number to become very, very high. That white blood cell count can be low, and that can also point to sometimes just being normal for somebody. It can also be a sign of a disease process. Hemoglobin and hematocrit are measures of the red blood cell and oxygen carrying capacity of the blood. There are very few people who have high amounts of those,
Right.
but there are, of course, exceptions to everything. Most of the time what we notice is that people's blood counts are on the low side.
Yes.
And again, the reasons for that can be varied. Everything from nutritional deficiencies. We're not getting enough iron in our diet, B12, folic acid. Sometimes it's not even that we don't get enough of those things in our diet, it's that the body doesn't absorb those minerals and vitamins as good as it used to. That gets into my previous statement, the body doesn't do anything as good as it used to as we get older. And so it doesn't absorb things like iron the way it used to. Of course, if we're losing blood, we can pick up on it in that testing. Some people, if they are bleeding internally, that's a very rapid, violent process, and it's very clear very quickly that there's a problem. But for some people, that's much more subtle. It's like a drippy faucet. There's just one drop at a time. Mm-hmm. They don't notice anything's wrong until they say, I don't feel good, my energy's not good, and we notice that that hemoglobin and hematocrit numbers are low.
All right.
And that takes us in a different direction.
My father passed away during COVID, and for the last year of his life, probably lost 60 pounds because he wasn't eating anymore and he was drinking very little and so on. He had no interest. He was 99 and he had no interest in it. Yeah. But I remember his hemoglobins, just you could start seeing from when he was in his early 90s to the end of his life, just going downhill as his nutrition decreased.
Yeah.
Let's talk about the basic metabolic panel. I know that it also encompasses a lot. I think most people are familiar with good cholesterol and bad cholesterol and total cholesterol.
Mm-hmm. Okay, so a basic metabolic panel doesn't include cholesterol. That's a little bit different.
Lipid panel. I'm sorry.
So a basic metabolic panel includes several electrolytes, different salts that your body is supposed to have, including kidney function.
Okay.
The lipid panel measures several different things. A standard lipid panel is measuring the total amount of cholesterol. There's HDL, which is a good type of cholesterol. Yeah. This is actually the cholesterol that gets removed from the bloodstream, put back in the liver where it's supposed to be. There is LDL, that's the cholesterol that has historically always gotten the most attention. This is the bad cholesterol that builds up in our blood vessels, slowly causes those blood vessels to narrow and sometimes to rupture, which leads to heart attacks and strokes. There is triglycerides, which I referred to. This is a large component of the fasting aspect of blood work. Triglycerides can vary for a lot of reasons. There's genetic conditions that can impact all of these types of cholesterol. And those triglycerides in particular also vary with other disease processes, diabetes being an example of that. So we'll see that lipid panel vary quite a bit and can be indicative of other problems as well.
Okay. Thyroid disease and thyroid panel. I have that test done only because my father had thyroid cancer, and I guess there's a potential genetic link. So does everyone get a thyroid panel every year at least?
So not everyone every year, but most everyone. Thyroid hormone in our body sort of dictates the pace at which all of the cells in our body are burning sugar, burning glucose. And so when the thyroid isn't working well, the symptoms for that can be wide varying. And so it can be really hard to tell when someone is sitting in front of you and you're talking to them and whether they could have a thyroid problem or not, because if we imagine any organ that we have not having all of the energy and sugar it needs to do its job, the symptoms are just incredibly wide. And so thyroid function can then affect cholesterol numbers. It can impact your heart function. It can impact your other things. And so with many disease processes, the thyroid is a possible cause. When someone comes in with symptoms, they're not feeling good, their energy isn't good, their memory's not as good. There's a lot of reasons that can happen, and thyroid is one of those. And so most people end up with a thyroid test because it can contribute to so many different disease processes. It's involved in so many very subtle symptoms that people have. And it is a really common disease process, not just worldwide, but especially in this country. So it is something that we're always on the look for when people are noticing that they're not feeling well.
Okay. I want to ask you two things, and you tell me, because we have 5 minutes left, which one is the most important to discuss, blood pressure or kidney function?
Ooh, I don't know that I want to pick one of those. It's like picking between your two favorite types of candy, except the opposite of favorites. The blood pressure is probably something that is not only more easily monitored and can have wide variances throughout the day. You don't need to be in a doctor's office these days to see where your blood pressure is at. And blood pressure can impact a wide variety of body systems. Heart and kidneys being the two most, but certainly things like strokes and other types of conditions, blood pressure has a huge impact on the health of those body systems. Oftentimes when we talk about damage to kidneys or hearts, that refers to the blood pressure being high over a long period of time. But there are other things that can contribute to the blood pressure having wide variances throughout the day. Kidney function is really important. For any of us who've known someone on dialysis, dialysis is a tough life. It's 3 to 4 hours on a machine 3 times a week, and you never really feel great. And some people get used to that because that's their new norm, and they do really well with that. But a lot of times it's something that's very hard for people, and avoiding that kidney damage and the kidneys progressing to a point where they can't take care of the body is critically important for almost all of our older adults, our younger adults included, and the blood pressure is a piece of that.
Blood pressure parameters were changed in the last 5 years, were they not, to come down so that it's a narrower range of acceptable. If someone is in first degree, second degree, third degree, I hear this, kidney disease, is that something in their 70s and 80s to be terribly concerned about, as long as they're leading a relatively healthy life and seeing their doctor regularly? Is that something that happens not infrequently as we get older, or no?
Yeah, so the staging of kidney disease can be a little bit tricky because as we get older and our kidney function declines naturally, you will oftentimes get chronic kidney disease, and I'll use the term stage 2, as an almost normal process of aging.
That's what I've heard.
The kidneys just don't do what they did when we were 25.
No matter how much water we drink.
And so chronic kidney disease by itself doesn't necessarily indicate a disease process or that we need to change the way we are eating, drinking, exercising, and behaving. Certainly, though, when we get to chronic kidney disease stage 3 and 4, there's a kidney disease stage 5 that really is the last stage before dialysis and end stage renal disease. And those are certainly very important. Not only does that affect the way someone is feeling on a daily basis, it affects over-the-counter medicines that we can and can't take. There are other hormonal systems that don't work as well either when the kidney disease has progressed to those stages.
I think that you have done a wonderful job. I bet you do this with your patients too. You explain things this well.
I get a little bit chatty, and so I like to talk and talk and talk and talk.
That's a good thing. I like hearing it.
I don't like when someone leaves and doesn't know what we were talking about, or goes home and says, "My doctor said I should drink more water." That's really not very specific.
No.
Why did your doctor tell you? Because that's really important.
And what is it going to do? That's right. I can't thank you enough for being here. I know I could have another hour, I think, talking to you, Dr. Oneill. Thank you for watching North of 60. If you want information about Dr. Oneill's office and where it is and a phone number, you will see that posted at the very end of the show. So thank you for watching.
Thanks for having me.